I'm Robert Roberts, President of the University of Ottawa Heart Institute in Ottawa, Canada. My presentation relates to genetics and inflammatory disease of the atherosclerosis and heart disease. We all recognize that there are many genetic influences that affect atherosclerosis and heart disease. And until recently, we did not have the technology to identify them. In 2005, when the technology became available, our institute identified 9p21 as the first genetic risk factor for heart attacks and coronary artery disease. Since that time, we have joined with many others, and today, as I will announce, that we now have 50 genetic risk factors associated with heart attacks and coronary artery disease. Of those 50, 15 mediate their risk for heart disease through known conventional risk factors such as cholesterol, increased blood pressure, or diabetes. However, 35 act through mechanisms as of this moment unknown. We are therefore looking at what mechanisms are involved, and one of the things we've adopted is looking at what's called genetic and metabolic pathways. These are molecules that mediate a variety of effects. And what we have recently shown is that at least 3 of those genetic risk factors mediate their effect through inflammation. And so it really brings to a further supporting evidence that inflammation is part of the risk for heart disease. Now, there's certainly other evidence from epidemiological studies that have been done over the years to suggest that. The genetic, I think, does indeed tie together. And overall, what this indicates that coronary artery disease, we know, is in large part preventable by preventing risk factors. Many have claimed that this is the last century for heart disease. To whatever extent that is true, clearly in the future, in order to prevent it, it won't be enough just to treat conventional risk factors such as cholesterol and blood pressure, but also we'll have to seek out those genetic risk factors that obviously mediate their effects, such as to inflammation. Therefore, comprehensive prevention will have to include the role of inflammation in myocardial infarction and atherosclerosis.